I invite Dr. Reena SETHI. She's going to talk about how to make the surgery effective in a community. That is, least expensive surgery and best quality. I think quality should be maintained. That should be our approach. Best quality with least expenses and better, facilities. Reena, all yours.
Thank you so much, and a very good morning to all. I'd just like to add one thing about the camps. We've noticed, we've done a little study also with our camps, and we've seen that when we have camps in the outreach, we have a lot of women coming in the camps. And when we have a clinic at our hospital, we have less women and more men coming. So I think that is one thing also has to be considered. Yes. Okay. So cataract surgery, the sight restoration and the cost-effective approach. Now that we've got the camps and we've got the patients in for cataract surgery, we need to restore their vision. And what is going to be our primary goal is that they have to have quality of life has to become better with the correction of vision. And we know the common techniques that we do for our cataract surgery are phacoemulsification and small incision cataract, manual small incision cataract surgery. And we have our successful parameters, which is the visual acuity and the improvement, and most important is the patient satisfaction. So these are the two different approaches that we can take consider in our camp patients. They have their advantages, they have their disadvantages. One is a low cost, minimal equipment, effective outcomes, and low resource settings are required. The other one, that is a phacoemulsification, is quick recovery, better for complex cases, and much faster if you're once well versed with phacoemulsification. But the equipment cost and the other paraphernalia is much more expensive in phacoemulsification. Now the financial planning has to be done for these patients who we brought into our hospital. We need to be offering a tiered approach for their surgery. So basically, if we consider our example of our hospital, what we do is we do a cross-subsidy module where we have the non-paying section, the patients who are coming from the community outreach camps. Then we have the subsidized, and we have the patients who are paying. So the ones who are paying, they pay also for the patients who are bringing for the camp. So this is a cross-subsidy model. We have the NGO grants, as well as we have now a lot of good, things in which we can have the PM funds, like you have the AIOS2025, the PMJ, which do, and they've given the patient a bit of a dignity when they come into the camps. They have the card, they feel that they can demand the service. So that's a very good approach, I think, which are at the moment we are having. So we also need to explore a lot of other partnerships, as well as the other organizations who are doing NGO work and have funds to do something for the eye services, and the CSR part also, which the 2% profits have to be given to a community-based organization. The cost optimization in a surgical procedure is what we need to understand. We have limited resources, we need to make the best of it, and we need to give the best quality to the patient. So we need to reduce the cost in our hospital. The only important thing here is we need to standardize it. It has to be like an orchestra. The patient comes, people must know who has to take care of the patient at what level, and they need to come to the OR, and the OR also, everybody should know their responsibility so that everything runs very smoothly. And implementing batch processing is very important. So you need to know that, okay, I'm ready for 20, I'm geared up for 20 patients, free patients, or 30 patients, and everything should be very systematic, and proper SOPs have to be followed there. You need to reduce the cost through high volume surgical, because the number of patients you do, it's going to be easier on your financials also. So increasing the number of surgeries per session optimizes your workflow. Training your staff, like I said, to perform efficient patient preparation, post-op care, minimizing the turnaround time between surgeries is the important part. We need to reduce per patient surgical cost as well. So implementing task sharing among the trained paramedical staff to reduce the burden on the surgeon. So this, if you have somebody who's going to load up your lens for you, I think that is one thing that really is a step that can save a lot of time. And if you have multiple tables, like you have in the other systems, in other hospitals which are doing number of surgeries, then the nurses know that they need to prepare the patient earlier before the doctor gets free. So that way you run a faster system, and you can adopt Indian IOLs, which are so good that they can also give very good results to your patients. Maintaining quality while reducing the costs. Well, you have a lot, this is a challenge, then we can now go and doing different challenges, but there is a solution, and that is the SOPs which you make, maintain the quality regardless of the cost cutting measures. Regular monitoring of your outcomes is very important. You must have a proper registration in which you know what complications you had and how you're going to overcome them, or wherever there was something that needed to take more time, so you need to solve the time issue as well. And use cost-effective yet reliable surgical techniques like the manual small incision technique that maintain good patient outcomes. Efficient use of surgical instruments, so you need to may have more reusable instruments rather than disposables like we have in the US and the other places. We have the autoclaving ETO system which has to be used. Prepare proper kits so that you don't have to keep looking for instrumentation. That is one thing very important when you're doing your surgery. And the protocols for proper maintenance and longevity of surgical tools. So invest in good surgical instruments which can be used again, but need to be, you know, they have a good life. Organize them well so that you know where is what, and not, you know, you need to have one black box also for you, for in case you had land up in a complication, you need that, those kind of instruments, they should be also ready at hand. Efficient sterilization and maintenance is very important. We don't want to have TAS, we don't want to have endophthalmitis. So we need to train our staff to have proper sterilization of the instruments. So training of the staff for proper sterilization techniques is very, very important. We need to minimize the post-surgical expenses as well. So most of the medication which are generic post-operative medications where we know that they've been, you know, can be used, should be given to the patient. Educate the patient as to how they have to use their drops, or post-op prevention infection is very important, because sometimes these patients go back into the community and then they may not come back to you, or with the follow-up is not that rigid with them over 1 month, 2 months. So all the more the prevention tools should be given. What we do is we give them a QR code. Everybody has a mobile. We make them see the video. All the do's and don'ts are explained to them. So that is a good memory lesson for them also. So another financial constraint is the limited funding in our surgical programs. Apply for government subsidies, grants dedicated to eye care. CSR is available, so knock at the doors of these big firms and ask them for some partnership. And implementation of the tiered approach is also a very good model to take care of these patients. The challenge also is in the program initiated with external funding. We struggle to continue independently. Like Dr. Arun said, that you may get it for a short period of time, but then after some time your finances, they just die out. Then what are we going to do with the patients? So here again, you have to do some income generating services within the eye care programs. So what you can do is the paid patients, they pay for the non-paying patients. So cost subsidization model is very important. Low patient awareness and engagement is a challenge. So you need to conduct community outreach programs to educate. So your camps should not only be for collecting cataract patients, they should be for prevention, for education, and to tell them about, you know, all these taboos which they have in their mind, the cultural beliefs, not getting operated in summers, etc., and so many other things which need to be made, they need to understand. So you need to have good counselors in the camps to make them understand all this. There's a challenge of shortage of trained ophthalmologists and surgical assistants in rural areas. So there's a lot of mismatch. So high training costs are there for these skill enhancement programs. So the solution is to train local health workers, lift them off. You have the ASHA workers to identify, you know, cataracts or other, problems in the community. Implement task shifting strategies where trained nurses, paramedics can handle pre-op and your post-op, so that they can identify if there is a problem and then refer them back to the hospital. There could be some infrastructure limitations also. So you need to optimize your existing space to create multifunctional surgical units. So invest in basic but durable equipment that can withstand frequent use. There are a lot of logistic barriers also to the access. So organize mobile eye camps to bring services closer to the rural population, collaborate with local authorities to provide transportation support for the patient, and set up the telemedicine consultation, which is a very good tool to identify so many problems which are there in the rural population, but they cannot reach the hospital. And one last note about the post-operative care and the challenges. So inconsistent follow-up care could be a problem in most of the patients who are coming from very far off. So develop a follow-up protocol that is easy to implement and track. Train the community health workers to follow up and conduct the home-based follow-ups for them. And always we need to monitor and evaluate all our data, because we need to grow, and to grow we need to know our data and to know whether we need to make some more amendments in our different policies. Thank you very much for your patience listening. Thank you.
Thank you so much, Dr. Reena.